Thanks, Rob. Great insights. Hi, everyone. I'm Tjeerd Brennikmiejer, or TJ, EVP EMEA at Bloomreach, and I'm excited to be joined today by Roger Donald, Head of Delivery Management at NHS Digital, the UK's National Health Service Information and Technology Partner. For some of you who may not be aware, the NHS Digital is committed to transforming and connecting healthcare services within the UK to deliver a better, more personalized service to patients, as well as maximizing taxpayers' investments into the system. In his role, Roger is responsible for the NHS Digital website, which covers over 400 products and services ranging from cybersecurity for the NHS to big data publications. He oversees a multidisciplinary team of product owners, delivery managers, content designers, and software developers. The government has committed to digitalizing the UK's healthcare system by dedicating £4.2 billion over the next 5 years to utilize technology to meet rising expectations and escalating demands of a population used to instant access at their fingertips. It's safe to say that especially during this time, we have seen just how important technology is to help track, trace, and manage the impact of the global pandemic we find ourselves in. Thanks for joining us today, Roger. Some questions to start off the conversation. To begin, for our international viewers, it would be great if you could please tell us a bit more about the healthcare landscape in the UK.
Yeah, sure. So I work for the National Health Service. It's brilliant. It's free at the point of delivery, TJ. And that means for everybody, whether you're rich, young, old, poor, and it's, because it's free, it doesn't mean that nobody pays for it. It's paid for mainly through our taxes.
That's great, and especially that everybody can use it. So to start off with, I think the most important question a lot of people would like to learn about is like the COVID-19 situation. How has that had an enormous impact on the healthcare sector, putting hospitals and staff under considerable strains? At the beginning of the outbreak in March, you had over 2 million visits to the NHS website in just one day. How have you managed to deal with this surging need for information?
So to be honest, the needs during the pandemic have been astronomical, but the services that we've created are set up to scale, to be honest, TJ. Now we've seen the demand driven because of the news coverage about some of the services that we provide. We told, the whole business was kind of told to be ready for these surges, but we didn't quite expect the size of surges that we got. So the NHS app, one of the things that we deliver here at NHS Digital, 95 times more traffic than you would normally see kind of from previous peaks. Our NHS 111 service, which kind of does digital triage and telephone triage assessments, that's seen a 12-fold increase in kind of demand. But because of business continuity planning, we've been ready for we've kind of been ready for it, and we've ramped up and met the demand.
Yeah, I think NHS has done a tremendous job during this pandemic and is continued to do so. So can you tell us more about some of the solutions you put in place in response to COVID-19?
Yeah, so on our website, we've kind of really grown a coronavirus sort of hub, if you like, a series of pages that since kind of March and over time has got bigger and bigger. And some of the information that we've been putting on there is to help protect the most vulnerable people in our society. So that's kind of called shielding for patients. So we've been putting advice for hospital trusts and GP practices and doctors about how to create a shielded patients list. And as that advice has been changing over time, we've been publishing and updating that advice, and we've seen loads of traffic to that. We've also been providing kind of data, so visualizing that kind of data about shielding patients and putting that onto the website so that you can see regionally where all the patients are that are shielding and where those densities are, what the age demographics are. We've created an isolation notes service that kind of, so when lots of people need to go off sick, kind of those sick notes can be kind of delivered. We've been helping roll out collaboration services like Microsoft Teams to the rest of the NHS to really help with those video consultations and things like that now that people can't get into, into physical locations of care.
Yeah, thanks. Yeah, a lot of things going on at the same time. So I was wondering, what were the biggest challenges you faced to date with NHS, like digital transformation journey?
Oh, wow. So if I draw on my experiences of digital transformation, I think one of the biggest challenges for me has been getting user-centered design practice kind of embraced. So typically, lots of businesses operated in this kind of hippo-based culture, and that hippo for me stands for the highest paid person's opinion. So often that would drive the solution, and user-centered design and focusing on user needs is actually kind of put patients and citizens at the center of the services that we're producing. So that's been a real education for many of us. But also, the transition from waterfall to agile delivery, that's been something that kind of everybody's needed to go on a journey for. And then probably lastly, I'd mention the difference between technical change and adaptive change. So you can't just release the technology and expect that to solve the problem, TJ. You have to have a lasting dialogue with the frontline users of the technology or the services that you're providing, so that they can actually make the change happen, and they can feed back the kind of the issues and problems and successes that they're having to the kind of software developers and product developers that kind of sit in businesses like ours.
Yeah, and from a different angle, you're sitting on lots of personal and sensitive data, with security being a top priority. How do you balancing moving quickly to develop new applications and digitalizing like processes while ensuring data remains secure?
So you're right. We do sit on a wealth of data that gets produced by the NHS and the bits that are connected to the NHS, and we have absolute armies of people kind of working on those data, whether they be kind of the data scientists or the legal and information governance teams through to the software development and product development people. And so we make sure through those processes, those stringent processes, that we don't put patient identifiable data out into the public domain. We have secure spaces for that, where those people that are trusted and are allowed to access that information can go and get it. But we pseudonymize and kind of make sure that things are deduped and all the personal elements are taken out of it before we put that into some of the kind of the dashboards and the publications that you're seeing delivered through our website.
Yeah, and then I think an important question for a lot of people attending this conference is, could you tell a bit more about how you use Bloomreach within the NHS?
Yeah. So we use platform as a service from Bloomreach. We're on on-demand version 1 with plans to move to OD version 2 in the near future. That's what kind of hosts the website that we produce. We're also planning on bringing the intranet onto that platform as well. So we're creating a new one of those. And we've been really pleased to work with you guys on content search, because we do such a broad range of things. There's so many customers across so many different areas, making sure that we provide a relevant and contextual on-site search experience has been a real prime focus for us. So we're looking forward to delivering that in the really near future in collaboration with you guys.
Yeah, we are also looking forward to continue our joining partnership together. Thanks, Roger, for joining us today and all the insights you provided. I'm happy to wrap up the Lightning Customer Talk. Please enjoy a short break, enjoy some videos and music before we start the next session.